Omega-3, a trial for treating ADHD. Kimberly Sievers, Southwest Baptist University. Introduction. Is it possible to treat ADHD with supplements rather than stimulants, reducing the symptoms related to the diagnosis that affects behavior, cognitive, and mood, along with the side effects of amphetamines, including nervousness, restlessness, excitability, irritability, agitation, and addiction? Is it possible to treat ADHD with supplements rather than stimulants, reducing the symptoms related to the diagnosis that affects behavior, cognitive, with the side effects of amphetamines, which include nervousness, restlessness, excitability, irritability, agitation, and addiction? If we could treat pediatric patients with over-the-counter supplements or diet rather than stimulants, could this further the treatment in preventing pediatric patients under the age of 18 with non-stimulants side effect medications? Why is this topic important to me? I've chose to research this topic because I am one of many that have been diagnosed with ADHD. It wasn't until I was in nursing school 8 years ago that this diagnosis came to light. During that time, I struggled throughout high school, not knowing why I had to read the same page over and over and over again, and I really thought that I was not intelligent enough to be in school. Once diagnosed with attention deficit hyperactivity disorder, I started on medication myself. Recently, I am still taking Adderall now that I'm back in school. However, I do not like the side effects as when I come down with the nervousness and agitation. That led me to start researching other alternatives. I do have 2 children that have also been diagnosed with ADHD. In treatment options, my oldest, which is now 25, was prescribed Ritalin and Adderall for 10 years with a multitude of side effects, including weight loss, nervousness, agitation, and behavioral changes during the half-life of the medication. During that time, I didn't know as a single mother how to get my kid through the day of school because he was constantly in trouble for disrupting the class, moving, making noise, etc. The past few years, since I've been diagnosed myself, I have started researching other options to teach because my youngest has also, who is 12 years old, been diagnosed with ADHD. With that decision, with the side effects that I've seen my son have, I have made the decision not to treat her with a controlled substance. Omega-3 is the new supplement. Omega-3 is the new supplement that I have never discovered until my research in this class. I chose to research this topic because I am one of many that have been diagnosed with ADHD. It wasn't until the age of 24, 25 that my physician had mentioned that I could possibly have the diagnosis of ADHD. I was not tested until my first semester in nursing school 8 years ago, and it really was kind of life-altering, changing the fact of when they did prescribe me the Adderall, it not only gave me energy, which is an awful side effects that a lot of people get addicted to, but it allowed me to focus. I couldn't understand in high school why I read the same page over and over and over again and why I could not comprehend. I was an average BEC student, but I did not go to college right out of high school because I felt that something was wrong with me. It wasn't until 22, 23 that I started getting my foot in the door and taking college classes. Now that I'm grown, I have 6 children, and 2 of my children have also been diagnosed with ADHD. In treatment options, my oldest, now 25, was prescribed Ritalin and Adderall for 10 years with a multitude of side effects, including weight loss, nervousness, agitation, and behavioral changes during the half-life of the medication. With that said, there was a point in my life when I was a single mom and I would send my kid to school. He would get in trouble. He would be in the principal's office. He couldn't keep still. He couldn't quit talking. So he actually had his own desk in the principal's office where he did his work. So during that time, we took him to psychologist and they gave him a prescribed prescription for Ritalin. I didn't know as a single mom what to do, so even though he complained about the side effects of it, I made sure that he took it in the morning at lunch just to be able to make it through school. So with that said, now that he's grown and 25, he's not on any medication, but to this day, he still talks about how that medication affected him and how he would never take it again. And now he has a 4-year-old daughter that's showing some behavioral changes that, symptoms of ADHD, and he swears he won't put her on it as well. So the past few years, I have researched other options to treat my youngest daughter, who is 12, and I have made the decision not to treat her with a controlled substance at the pediatric age. It wasn't until omega-3 caught my attention during this paper that I decided to research and see if it was able to help. Why is this topic important to me? Attention deficit hyperactive disorder has been a common psychiatric diagnosis in both children and adults since the 1980s and 1990s in the United States. But the diagnosis was much less common, even unknown in other parts of the world. By the end of the 20th century, this was no longer the issue, and ADHD diagnosis and treatment became increasingly widespread. Why is this topic important to the healthcare system? Abuse of prescribed stimulants increases in risky behaviors, legal issues, or death. The availability of the prescription of stimulants can be dangerous to young adults not equipped to handle the responsibility of appropriate use. Why is it important to patients or the subject of my review? Prescribed stimulants abuse continues to rise, along with prescriptions for ADHD disorders. When used with targeted symptoms, the medications are effective. However, this escalating crisis is being overshadowed by the current opioid epidemic. It is to be said that college students are constantly on the rise to buy these prescription stimulants to be able to stay up later to study, etc. Why is this topic important to the public? ADHD has been... Why is this topic important to the public? ADHD has been a common psychiatric diagnosis in both children and adults since the 1980s and 1990s in the United States. But the diagnosis was much less common, even unknown in other parts of the world. By the end of the 20th century, this was no longer the case, and ADHD diagnosis and treatment became an increasingly widespread global phenomenon. Why is this topic important to the healthcare system? Because of the abuse of prescribed stimulants can lead to increases in risky behaviors, legal issues, or death. The exposure and availability of prescription stimulants can be dangerous to young adults not equipped to handle the responsibility of the appropriate use. I want to talk a little bit about this prescribed stimulants. My oldest daughter is 22. She was asked on campus several times if she wanted to buy Adderall, that it would help her stay up and study, and also some of the cheerleaders took it for weight loss. So with this said, again, stimulants can be very dangerous because you take one, you take two, you get the high of staying up, being able to study all night, the focus ability, so it can become increasingly addictive. Why is it important to patients or the subjects of my review? Again, Prescribed stimulant abuse continues to rise along the prescriptions for attention deficit hyperactivity disorders. When used with the targeted symptoms, the medications are effective. However, this escalating crisis is being overshadowed by the current opioid epidemic. I'm a mother of 6. I go to, I'm getting ready to start nurse practitioner school when I finish my BSN. And I can tell you, it is, as a 45-year-old woman, it has, on days that I did not take my Adderall, I would have extras, and it's crossed my mind to go ahead and take another so I can stay up and get things done. So as a 45-year-old woman who I feel very confident that I don't abuse prescriptions, this is pure in case, if I chose to take one, abuse and the prescribed stimulant. PCOT statement. P for population would be the pediatric and the adults. I for intervention, using over-the-counter supplements, such as omega-3. C, the comparison intervention is the stimulations which are controlled substances, such as amphetamines. O for outcome, to reduce the side effects of stimulants. And T, time, over a 3-month period. Databases searched. The 3 databases used were ECRI, Cochrane, and PubMed. Search terms used. Treating ADHD with supplements, over-the-counter treatment for ADHD, omega-3 for treatment of ADHD. The Boolean operators used, ADHD and supplements or stimulants. Search results. The first database searched was ECRI. The search term used, treating ADHD with supplements. Results 0. Search was narrowed by keyword ADHD. Results 1. Results did not yield any interest in ADHD that pertained to the subject of the study. The next database was Cochrane. Search term used, alternate treatment used for ADHD. Results were 325. Search was narrowed by keywords, supplements, and ADHD. The results then were 26. There were 125 trials of different supplements tried and looked at, like vitamin D and fatty acids, along with how changes in diet can decrease symptoms of ADHD. The third database was PubMed. Medline was used with full text. Combined terms such as ADHD and capitalized supplements or capitalized stimulants. The results was 2,570. The search was narrowed or filtered by using peer-reviewed and dates 2015 to current. Discussion and summary of findings. The similarities. Measurements of the techniques were used to collect data were consistent. To collect the data of findings, the instrument was the ADHD Rating Scale version 4, the ALOOT test, CHI-TAPT behavioral test, and CPRS anxiety and depression test. What this showed was it was a ratings that parents each took and they turned into the doctors or psychologists. In return, the facility that did the findings looked over all of the rating scales to come to collect the data. Inconsistencies. In the result of the study, 2 patients in the DHA-EPA group experienced a severe adverse effect where they were hospitalized for worsening ADHD symptoms. However, the study was conducted with signed consents. With the inconsistency, the issue that is questionable here is what were the adverse events? What were the worsening ADHD symptoms? Was it due to the medication itself, Or was it due to the fact that they did not have the control over the behavioral changes where they, A, tried to harm themselves, try to harm others? So to me, the inconsistency of the study where the two had the severe adverse event, it created a gap to the point where much more information from those hospitalizations needed to be publicized. Discussion of the findings. Inclusions. Techniques was used to collect the data. They were very consistent. To collect the data or findings, the instrument was the ADHD rating scale version 4, the Adhd test, the CHI-TAP behavioral test, and the CPRS anxiety and depression test. The primary outcomes included safety throughout all testing. The study population included children and adolescents with hyperactivity symptoms. Part of the criteria for the study was the subjects had to have at least 6 hyperactivity impulsivity symptoms for 6 months or more before the age of 7 and percent of functional impairment in 2 or more environments, which I included school and home because technically that's where children of this age are. If they're not home, they're with the babysitter, caretaker, teachers, or with the parents. I want to kind of go back that, ADHD was really coming out in the 1990s. And I want to say that when my son was diagnosed, which was, he was born in 1993, it was just a test that they sent to school. I'm sorry, not a test, but a piece of paper that they sent to school to fill out and for us to fill out. And then again, all these stimulants were just written out to him. With myself, I have to be honest and say I went in, I told them my symptoms. There was no testing done, and I got a prescription for Adderall. Exclusions. In the exclusions, there is a known intolerance to omega-3 fatty acids, intake of fatty acids, fish oil, dietary supplement for more than 1 week. During the 3 months preceding inclusion or the NPH or other ADHD drug during the month preceding, including children who require the NPH treatment, were excluded in the results of the study. 2 patients in the DHA-EPA group experienced a severe adverse effect where they were hospitalized for worsening ADHD symptoms. Other inconsistencies included the amount of males versus females in the study, and it was only conducted in France. So 75% of this population that was studied were males. I feel that that's an exclusion, or it could be a limitation or a gap, strictly because, and I don't have the research to back it up, but I, as having my own children, boys are more hyperactive than girls, growing up with just behavioral from my point of view. So I personally feel like they needed to have the 50-50 gap, and I think that they should have raised it more towards 18. I do know that the study was only to 16. I feel 18 would have given it a better gap of the limitation where they could study more of the college level kids instead of stopping at 16 years of age. Discussion and summary of findings. Inclusions. Techniques used to collect data were consistent. To collect the data or findings, the instrument was the ADHD rating scale version 4, the Adhd test, CHI-TAP behavioral test, and the CPRS anxiety and depression test. The primary outcomes included safety throughout all testing. The study population included children and adolescents with hyperactivity symptoms. Part of the criteria was the subjects had to have at least 6 months hyperactivity impulsivity symptoms for 6 months or more before the age of 7 and presented functional impairment in 2 or more environments, which I included school and home. Going back to the early 1990s when this became such a phenomenon and it started out as, ADHD existed, I can tell you that the school had to fill out a form, and the form from the pediatric office, and the pediatric office looked it over, and that's when the diagnosis was made. I felt that the pediatric office did do a good job controlling the findings of my son when he started off on one level of the medication. They got 30 days later, they sent another form home, and that's how they increased the milligrams that my son stayed on. So there was very good communication between the pediatric office and the school that my son attended. Now, when I was diagnosed with ADHD, I can tell you there was no testing done. I walked in, I told him my symptoms. I had been a patient of my primary care physician for many, many years, and so the prescription was written. My brother, on the other hand, he did go through 3 different testing before he was diagnosed with ADHD, and he is a highway patrolman who works all different kinds of hours. So I had to kind of figure, were they thinking that he could have been one of these Adderall attention givers, so he was able to function. Exclusions. In the exclusions, there is known an intolerance to omega-3 fatty acids, intakes of fatty acids, fish oil, dietary supplements for more than 1 week during the 3 months preceding inclusions, or the NPH or other ADH drug during the month preceding including. Children who required the NPH treatment were excluded in the results of the study. 2 patients in the DHA-EPA group experienced a severe adverse event where they were hospitalized for worsening ADHD symptoms. Other inconsistencies, as I spoke before, included the amount of males versus the females, and the study was only conducted in France. So the limitations, exclusions that I feel that this finding had was the amount of males versus the females, that it was only done in France, and the 2 patients that actually were hospitalized for worsening ADHD symptoms. So that to me is a huge limitation, because as being a parent who has had kids with ADHD, I cannot imagine what type of symptoms that worsened where these kids had to be hospitalized. And the study did not go into any of that information. Gaps. Gaps included there was thought to be certain children benefit from supplementation, and that there were 2 ongoing studies at the same time to see if this was true. Limitations. Transferability in these findings were based on other populations who took the placebo pill rather than the omega-3. The 2 settings in the trial is a group of population who take the omega-3 and the ones who take the placebo. Another limitation in the study was the fact blood levels were never taken on patients pre or post trial of any subjects. As an RN, and looking back at my son, they always did at least every 60 days. They took blood to check his triglycerides and to check other levels to see if the medications were doing anything to his body that was adverse effects. So with that limitation, the fact of no blood levels drawn could skew the numbers in the findings. Continuing on with my last few symptoms or sentences where I was talking about gap and limitations. More gaps included that there was thought to be certain children benefit from the supplementation, and there were 2 ongoing studies to see if this was true. More limitations was the transferability, and the findings were based on the findings of other populations who took the placebo pill rather than the omega-3. The subjects in the study were subject age 6 to 15 of age who had been diagnosed with ADHD. However, 78.4% were male. With this being said, is there a certain correlation with ADHD in the male population, or is this just a percentage of subjects who signed up for the trial? I also have to ask, and this is, no research has been done, but my thought process of having sons is the male population during this time of age, mostly if they're 9, 10, 11, 12, and 13, are they more active and hyper versus girls who go through puberty a little bit quicker and more mature where they're more calmer? So I would really like to see this finding be more 50-50 and either stretch it out to the 18 years of age or break it down to say, okay, we had so many 6 through 9, we had 10 through 13, just to kind of see the differences of, those puberty ages. Another limitation of the study was the fact blood levels were not taken on patients pre or post trial in any of the subjects. Again, to me, this is a little bit alarming because my son had his blood drawn every 3 months. However, I have never had a blood draw, just urine test periodically for the insurance company to keep paying for it to make sure that it wasn't being abused and that the drug was in my system. Conclusions. In conclusion, this study was clearly written for the physicians and the behavior specialist in France. This trial could be useful for physicians and behavioral therapists to determine if there's a better way to treat ADHD without the use of stimulants. The major findings in this study alone was that it did not show any beneficial effects overall on the omega-3 supplements in children with ADHD. As for my own studies, I will continue to research other possibilities such as diet, exercise, as well as the benefits of CBD oil before I give my daughter a stimulant. This study was more of omega-3 for ADHD, but in a broader spectrum, I would really like to go into a study to see whether, DHEA or, if combined fish oil with lack of when I say diet, I've done some readings where they say the red dye in foods stimulate hyperactivity in children. So I would really like to go into more research when I am done with school to find out if there's more of a correlation that, can we treat it with fish oil and diet and exercise rather than giving these pediatric patients stimulants that could possibly have long-term effects with the agility, with, is it going to speed up your heart like caffeine? So that's the end of this PowerPoint, and I appreciate your time and attention. Kim Sievers.